This is USMLE QA, USMLE material presented in a question and answer format structured similar to the first aid for the USMLE Step 1 book.
Question: what is a trinucleotide repeat expansion disease? Answer: a trinucleotide repeat expansion disease is a genetic disorder caused by an abnormal expansion of a trinucleotide repeat sequence in a gene. Question: what are some examples of trinucleotide repeat expansion diseases? Answer: Huntington disease, myotonic dystrophy, Fragile X syndrome, Friedreich ataxia are examples of trinucleotide repeat expansion diseases. Question: what is the mode of inheritance for Huntington disease? Answer: the mode of inheritance for Huntington disease is autosomal dominant. Question: what is the trinucleotide repeat sequence for Huntington disease? Answer: the trinucleotide repeat sequence for Huntington disease is M. Question: what is a mnemonic for Huntington disease? Answer: a mnemonic for Huntington disease is Caudate has decreased ACh and GABA. Question: what is the mode of inheritance for myotonic dystrophy? Answer: the mode of inheritance for myotonic dystrophy is autosomal dominant. Question: what is the trinucleotide repeat sequence for myotonic dystrophy? Answer: the trinucleotide repeat sequence for myotonic dystrophy is N. Question: what is a mnemonic for myotonic dystrophy? Answer: a mnemonic for myotonic dystrophy is cataracts, toupee, gonadal atrophy in males, reduced fertility in females. Question: what is the mode of inheritance for Fragile X syndrome? Answer: the mode of inheritance for Fragile X syndrome is X-linked dominant. Question: what is the trinucleotide repeat sequence for Fragile X syndrome? Answer: the trinucleotide repeat sequence for Fragile X syndrome is N. Question: what is a mnemonic for Fragile X syndrome? Answer: a mnemonic for Fragile X syndrome is chin, giant gonads. Question: what is the mode of inheritance for Friedreich ataxia? Answer: the mode of inheritance for Friedreich ataxia is autosomal recessive. Question: what is the trinucleotide repeat sequence for Friedreich ataxia? Answer: the trinucleotide repeat sequence for Friedreich ataxia is N. Question: what is a mnemonic for Friedreich ataxia? Answer: a mnemonic for Friedreich ataxia is ataxia. Question: what is genetic anticipation? Answer: genetic anticipation is a phenomenon where the disease severity increases and age of onset decreases in successive generations with a genetic disorder. It is seen in some trinucleotide repeat expansion diseases. Question: how does trinucleotide repeat expansion lead to disease? Answer: trinucleotide repeat expansion leads to disease by altering the normal function of the affected gene. In normal individuals, the number of trinucleotide repeats is usually stable and does not change from one generation to the next. However, in some individuals, the number of repeats can increase, leading to an abnormal expansion of the repeat sequence. This expansion can disrupt the normal function of the affected gene, leading to the development of a genetic disorder. Question: what are some common symptoms of trinucleotide repeat expansion diseases? Answer: common symptoms of trinucleotide repeat expansion diseases vary depending on the specific disorder. Some common symptoms include muscle weakness, ataxia, cognitive impairment, and behavioral changes. Symptoms also vary depending on the stage of the disease and can include movement disorders, difficulty with speech and swallowing, and psychiatric symptoms. Question: how are trinucleotide repeat expansion diseases diagnosed? Answer: trinucleotide repeat expansion diseases are typically diagnosed through genetic testing. A blood or saliva sample is taken and analyzed to determine the number of repeats in the affected gene. If the number of repeats is found to be expanded, a diagnosis of a trinucleotide repeat expansion disease can be made. Some diseases have specific diagnostic criteria that need to be fulfilled before a diagnosis can be made. Question: how are trinucleotide repeat expansion diseases treated? Answer: there is currently no cure for trinucleotide repeat expansion diseases. Treatment options focus on managing symptoms and slowing the progression of the disease. This may include physical therapy, occupational therapy, speech therapy, and medications to manage specific symptoms. Genetic counseling may also be recommended for individuals and families affected by these disorders. Question: is there any hope for a cure for trinucleotide repeat expansion diseases? Answer: research is ongoing to develop new treatments and therapies for trinucleotide repeat expansion diseases. Some promising therapies are being developed, including gene therapies and small molecules to target the affected gene. While a cure is not yet available, ongoing research offers hope that new treatments will be developed in the future. Question: what is the difference between trinucleotide repeat expansion diseases and other types of genetic disorders? Answer: trinucleotide repeat expansion diseases are a specific type of genetic disorder caused by an abnormal expansion of a trinucleotide repeat sequence in a gene. This is different from other types of genetic disorders such as single gene disorders, chromosomal disorders, or multifactorial disorders. Single gene disorders result from mutations in a single gene, while chromosomal disorders are caused by changes in the structure or number of chromosomes. Multifactorial disorders are caused by a combination of genetic and environmental factors. Question: are trinucleotide repeat expansion diseases only found in humans? Answer: no, trinucleotide repeat expansion diseases are not unique to humans. These disorders can be caused by the expansion of trinucleotide repeats in genes that control a variety of physiological processes. Question: are trinucleotide repeat expansion diseases always inherited? Answer: most trinucleotide repeat expansion diseases are inherited in an autosomal dominant or X-linked dominant manner. However, some trinucleotide repeat expansion disorders can also occur as a result of de novo mutations that occur spontaneously in the affected gene. This means that the mutation is not inherited from a parent, but rather occurs for the first time in the affected individual. Can trinucleotide repeat expansion diseases be prevented? Answer: there is currently no way to prevent trinucleotide repeat expansion diseases. However, genetic counseling can help individuals and families understand the risks of passing on the disorder to future generations and can help in decision making about family planning. Question: can trinucleotide repeat expansion diseases be treated with diet and lifestyle changes? Answer: while diet and lifestyle changes may be beneficial for overall health, they have not been shown to directly treat or cure trinucleotide repeat expansion diseases. Treatment options focus on managing symptoms and slowing the progression of the disease, which may include physical therapy, occupational therapy, speech therapy, and medications to manage specific symptoms. A healthy lifestyle can be beneficial for the individual living with the disorder.
Thank you for watching our Q&A format video. We hope this helped you learn, review, and retain knowledge needed for the USMLEs. For more information on this topic, check out the link in the description. Now, if you want to take your USMLE prep to the next level, be sure to check out all our courses, which are structured to follow along with the First Aid for the USMLE Step 1 book. You can find us at usmleqa.com. And if you're watching this on YouTube, be sure to like and subscribe.